Awesome. Welcome everyone to the Autism Society of Southern Arizona's Lunch and Learn for today. I'm super excited about this one. I met Jacob about a month or two ago, and he started telling me about Charlie Health, and I think it's a wonderful opportunity for a lot of people, and I'm very excited to be able to share with everyone and to learn more about it myself. So, that's what I got. Jacob, you want to go ahead and take it away?
Sure thing. Yeah, thank you so much, Kate. I'm really happy to be here with everybody today. My name is Jacob Meyer. I'm the clinical outreach manager for Charlie Health here in Tucson in Southern Arizona. Because we're a fairly small group, before we dive into it, if you guys are comfortable, whether just kind of unmuting and just introducing yourselves and letting me know sort of where you're here from and what would be your superpower if you could pick one. Do a quick little icebreaker. All right, I'm gonna call on Maya first because your camera's on.
My name's Maya Asher. I'm a therapist in town and I work a lot with the autism community. And I would say my superpower, if I could have one, would be to stop time like with a remote control.
Oh, that'd be phenomenal. I'm thinking of the movie Click with Adam Sandler.
Yeah. Yeah. Like if I could just like click and take a nap and then go back to what I was doing, like that would be the best superpower.
Absolutely. Is anybody else comfortable coming off mute and introducing themselves and sharing? Well, I won't belabor the point, and I don't.
Oh, look at Haley.
Oh, hey, Haley.
I'll share mine. I wish I could read people's minds, but most specifically, autistic people's minds. So, like my sons, just want to read their minds.
All right. Well, if anyone else want to share before I get started. Okay, so well, in the interest of time, I'm just going to go ahead and get started. So, a little bit about me: born and raised here in Tucson. My background was actually in the nonprofit world. First, I worked doing immigration advocacy work and sort of legal assistance for asylum cases, and then made my way to a foundation, and I was working with a lot of the grantees around supporting their boards. And Charlie Health reached out to me and explained this program. And essentially, sort of, I'm going to get into more detail here, but the 10,000-foot view was that they had started in 2019 as a way to provide a high level of behavioral health care to people who are really in crisis quickly, sort of recognizing that too many people were stuck on wait lists, they were having a hard time finding providers that were covered by their insurance, and would end up not getting any kind of care or treatment until they would end up in crisis and in the emergency room or worse. And that as I was hearing it, I thought about my own personal experience. My parents had a really, rough divorce, and I wound up, really struggling with depression. And I wound up at a residential treatment center when I was 18, and I was in groups with folks who were, decades older than me, who were dealing with completely different, sort of issues and had totally different reasons for being there. Whether it was substance use or alcohol use disorder, whatever it was. And it was just really challenging for me to connect. And I mean, and I'm not somebody who, personally struggles with neurodivergence or lives with neurodivergence. And, that's a whole nother kind of set of complications of finding, competent providers and groups. But, that experience was traumatizing for me and ultimately didn't lead to my recovery. And, for the price I was paying, it certainly, didn't get a good return on investment. Fortunately, I had a good support system, and I was able to sort of receive, a patchwork of different resources that ended up, being the ticket for me to, building a recovery that I was really happy with and really proud of. But for many people who, were my peers at that time, who, maybe lived in rural communities or, were coming up, had different insurance coverage, that wasn't the story for them. And, unfortunately, like, many other, young people who are in my generation, like I'm more often than I would, care to admit, getting calls about, a friend who's no longer with us. And it's really, taking all that together, my story and this tool, I sort of took the leap to, to jump ship, and the job I was very happy with, to sort of, begin doing work with Charlie Health. It's been phenomenal to get to connect with folks here in Tucson, and with Kate, and to find, the individuals that we can provide this service for. So before I kind of get into what is Charlie Health, I just wanted any questions about me, my background, before I keep going. All right, I'm going to go ahead and share my screen here. So can everybody see the slide that says connecting the world to life-saving mental health treatment? Okay, excellent. So who here is familiar with IOP, or intensive outpatient therapy, as a concept? Excellent. So a couple of us, those who I can see the hands raised, but for those of us who don't know, so IOP, it stands for Intensive Outpatient Therapy. And so this is a level of behavioral health, treatment that is, it's intensive, it's in the name. So within Charlie Health, our program is really, meeting that need within the community. And so kind of looking at some of the clients that we would serve, there are these two archetypes of individuals, and we work with a very broad array of folks, as I'll get into. So say Naya, 12-year-old, history of self-harm. She's already been to the ER twice. She's waited there for 20 hours. That in and of itself is a really traumatizing and disorienting experience that too many people in our community, when they don't have access to resources to manage, end up in crisis, and this ends up a common occurrence. But she has this real superpower that, she loves sketching, she really engages with it, and she engages with her art club. So these are, things that are really important about her lived experience. And then, take Sammy, 17-year-old, he suffers severe panic attacks, recently came out as bisexual to his parents. He went to a therapist, and, the only thing that the therapist would tell him is, you got to stop smoking weed. And this is the only thing that he's been able to find, that's been able to, help him manage his panic attacks, because he hasn't had access to other resources for people who are informed about, his lived experience and what's going to be the difference for him. But, he has his strength. He loves basketball, and he really is passionate. And that's a thing that, really gets him excited. So traditional barriers, what we found, in the landscape as it is. And I imagine that, many people, our friends, neighbors, ourselves, as we try to find care, can relate with some of this, struggling on a wait list, being told that a provider, doesn't have any capacity to take anybody. Maybe it's the only provider that your insurance will pay for, or the only one who deals with, your specific, kind of condition. And you end up waiting a super long time and hope that, you're not going to devolve in the interim. A lot of times, like, especially for IOPs, they're offered at a very small amount of locations physically, right? So the brick and mortar locations may be a really long way for somebody to commute to. And this is hours per week of therapy, right? So someone who lives out in Vail or Marana or Oro Valley, or somebody doesn't have access to transportation, let alone the time to drive 45 minutes one way, that becomes, prohibitive. And it can be lonely, right? You look at, like, in groups that are paired together, my personal experience of being like, all right, it's just an adults group, right? So it's 18 plus. Like, there are people who are, completely different generations, completely different lived experience, and it's isolating. Aside from, being an individual who's going through it, like, I'm supposed to be there connecting with these folks. And I, feel more alone because nobody is talking about the reasons that I'm there, right? The schedules are really challenging for people. A lot of times people have programs may have one time, right? And so if you can't make that work with your work schedule or your school schedule, whatever that is, whatever kind of external providers you may be coordinating with, that's a big barrier for people. And it's just generalized, right? I think a lot of people don't have, the experience to deal with whether it's, specific populations. Folks who have lived with neurodivergence, need providers and curriculum that's going to be really specific to, their lived experience, right? And the challenges that they face day in and day out. So in comparison, our care, Charlie Health is committed to having 0 wait times. So we do this by having a network of providers, across the 37 states that we operate. and by building our groups, across geographic regions. So we're able to have, if someone goes on our website, charliehealth.com, they're struggling, they need this level of care. They can, go on, get an intake appointment, typically within 24 to 48 hours. We can have them starting their first group. I've seen it in as soon as, 3 days or sooner. And, it really just depends on the person's scheduling flexibility and, how they get back to us. But we run 200 groups per week, 6 days per week. We have 3 different start times per day, morning, middle of the day, and in the evening. So we just try to meet people wherever they are, with their schedule. It's all virtual. We work with all the insurance providers in Arizona. So that's commercial, access, TRICARE. And, we do have, for folks who may have commercial insurance that, has a high deductible that hasn't been met, we do offer financial assistance as well. We're really, committed to making sure that cost isn't a barrier, to the extent that we're able to. And then me personally, I've been my nonprofit world background. I keep my sort of Rolodex of financial assistance resources that, if we can't bridge the gap, I want to make sure that either we can, get somebody some help or find somebody that'll work with them. So that's my personal commitment. So what we're going to do at intake, we look at, matching that individual with a primary therapist who's, competent in their lived experience, right? So whether that's dealing with folks who live with neurodivergence or survivors of sex trafficking, sex trauma, BIPOC individuals, whatever that is, we pair them in a group. So we build their group schedules, and we're making those really intimate. So those groups are going to be 4 to 6 individuals typically who are dealing with the same things, right? So it's not just adolescents who are, needing IOP. It's adolescents who, are neurodivergent and are, struggling with their gender identity, or who are neurodivergent and, suffer from anxiety and depression. And so we're getting that granular with it to really improve the likelihood that somebody's going to relate, right, with the other people who are around the table with them, so to speak, even though it's over Zoom. We get them started quickly. Hang on, I'm going to switch over to my next slide here. And as a part of the care ecosystem within Charlie Health, they get a lot out of that. So within those groups, they're going to be paired with those individuals who they're really going to be matched with. And they're going to be doing 9 hours of curriculum per week. So typically it's 3 hours, 3 days a week. Although, like I said, we can customize that based on folks' schedules. We run those groups 6 days a week. But it'll be a combination of that kind of talk therapy, right? So we're using those talk therapy modalities that are most effective for that population. And then we're also going to be blending in some experiential therapy and like art therapy, movement therapy. We send the supplies out for that. So it's, there's no shopping list. There's no trip to Michael's or anything. When you're in our program, we take care of everything you're going to need to participate. And I personally, I like to shadow the group sometimes and to, stay on top of what our curriculum is. I particularly love the breathwork ones. If I've ever had a stressful week, dropping into one of those, our instructors are phenomenal. So they're also going to be paired, like I said, with an individual therapist. They're going to be meeting with that individual therapist 1 hour per week. Our curriculum lasts 9 weeks, but we can customize the length of treatment on a case-by-case basis. So, if someone wants to do a shorter amount of time or would like to be in our program for a longer amount of time, we'll always work with you. We also have access to 24/7 crisis care, right? So when they're admitting into our program, one of the first things that we're doing is we're working with the patient. If they're an adult, any kind of emergency contact they have. If they're a minor, we're working with their guardians or their parents to develop a safety plan. Right. So, if this person is escalating in a crisis, what are we going to do? What are the nearby resources? When are we going to, get emergency services involved? They also have a crisis line within Charlie Health that they have access to, where they can get on the line with a master's level crisis clinician to hopefully de-escalate and stabilize, if we can, to address it right then and there. But if necessary, we can call parents in the other room and be like, you have to go check on this person, right? Make sure the door isn't locked or whatever it is. Or, God forbid, we get emergency services on the line and we get them to the location because we want to make sure people are safe while they're in our virtual care. We also offer med management. So for individuals who, maybe don't have a psychiatrist or they want a second opinion, we can do that consultation with them, look at their meds, see if it'd be appropriate to make any changes. We definitely have a philosophy of, minimal medication, if possible. We don't want to, over medicate folks, but we do have that available. And except for that, we don't do any controlled substances. So we can't prescribe Vyvanse, can't do, any Suboxone or anything like that. We do offer family support groups. Those are free. And so those are available to families who, may be struggling with supporting their loved one who's, going through this right now, and really just kind of wants more general sort of tips around how to be supportive and, how to manage their own feelings as, their loved one is going through it. We do offer family therapy as well, which is a separate component. That's an additional hour per week of our program. And that's the family unit working with the individual therapist to sort of, go through any sort of family dysfunction, anything that may be contributing to, that individual's hard time. They have access to sort of Charlie Cares, which is the app where they manage all of their sort of curriculum from. We do all of our courses over Zoom. It's fairly easy to access, and really, if you need to troubleshoot anything, we have a great responsive team, and they're going to, sort of a lot of that kind of peer support coaching as well is available if somebody isn't in crisis and just kind of needs to talk. Moving along, so our results. We've been in here, we've been in this space since 2019. We originally started, with ages 12 to 22, just in the Northeast, just to try to, prove that virtual IOP, sort of virtual therapy at this level can be effective. And what we found was that we were able to work with actually a broader range of folks because we're very successful within that age group, and then we could treat younger down to 11, so we can go as young as 11 now, and now we treat up to age 39. So we're able to work with a broader range of ages. We hope to continue to expand the ages that we treat, and working in that way. The populations we're working with is really acute. At intake, 75% of the folks that we're dealing with, they are having scoring moderate or severe on depression, 66% moderate or severe on anxiety. Almost half had attempted a suicide attempt at one point in their lifetime before finding Charlie Health, and close to 40% had engaged in self-harm. So this is a population that's, really struggling. So this isn't, Charlie Health is really, well suited for individuals who, like, we're very worried about them. They're on a path towards crisis. They need a very high level of support, sort of that, just needing to talk to somebody on like a once a month basis. We of course want to help folks find those resources as well. And it's important to care for your mental health on that kind of every level. But this is a really, sort of a dramatically, stressed population that we're dealing with. And so what we're doing is we're scoring them as we take them in on sort of incidents of self-harm. We're looking at, metrics for depression, anxiety, overall well-being and mental health. And we're tracking them week by week during treatment to sort of see how they're getting better. And then 3, 6, 9, and 12 months after discharge. And then we work with Yale, Penn, and Florida State University to do peer-reviewed research on our outcomes data and make sure that we're using that to constantly make our curriculum better, and really to develop best practices, for virtual behavioral healthcare of this level, which is new. And, many people have had to sort of shift their mindset about how this can be effective when it's done in an intentional way. And, so what we see as people are completing our program, almost a 50% decrease in those depressive symptoms, 70% decrease in suicidal thoughts, 50% decrease in the anxiety symptoms, and then a 71% decrease in self-harm frequency. I also want to point out that of folks who admit into our program, 90% are actually compliant with it. And so they're going to the sessions, they're completing the individual therapy, and they're doing everything they need to do to sort of complete our curriculum, which, as far as an engagement rate for this amount of therapy in a week, we're really, really proud of that. And I think it speaks to how we're able to design our groups in a way where people want to be there. They want to be engaging with their peers in this way, and continue making that progress towards recovery together. So this is something I'm particularly proud of, which is completing Charlie Health presents 96.5% of clients from ending up to readmit to a higher level of care post-discharge in that rolling 12-month period. So, within 1 year after graduating, we're not seeing folks by and large going back to the ER. So, if they've had recidivism there or at those inpatient, mental health hospitals, these are places that, serve a very important role in our behavioral health ecosystem when people are in crisis, but they should not be a first line, right? They are traumatizing in and of themselves, and we want to be there to catch people before they need it, and then to keep people from having to use it at all. And then we're also seeing really broad satisfaction, because we're really focused on getting phenomenal providers and leading with connection first. Both the patients and their families are really happy, with the quality of our care, the quality of connection, and how they're able to build recovery through participating in our program. So that's really all the slide deck stuff that I have to share. So I'm gonna go back and stop sharing my screen here. And definitely a lot of information there. I know I can certainly talk for a while. I hope I'm not too monotone. But I wanted to open up the floor for any questions, and sort of how this can relate with your work. Happy to speak to that.
Andrew?
I did have a question. So I work for raising special kids out of Phoenix, Arizona. So we do a lot of referring parents to different resources and things like that. And as a parent of a child who also has autism and ADHD and who could really benefit from something like this, how do you keep those kids engaged when it's online? Because that's one of the biggest things I think that I'm concerned about with trying something like this. And so I was just curious, what does that look like for somebody who's 13, 14, 15 years old who does struggle with ADHD?
Absolutely. So I'm really glad you asked that question. And it really kind of goes into how we're building the groups. It's really easy to disengage, if you're in a group with, 15, 20, however many people it is, of all kinds of different backgrounds, you're not connecting with them. But when it's, 4 or 5 or 6 people who are really going through the same things that you're going through, and the counselor can see if you're turning your camera off or disengaging. It's not, you can't hide behind another screen. It's challenging to disengage. So we work, of course, with the individual's family to make sure that all those conscientiousness pieces around like showing up on time and making sure that they have all the tools to actually log on are there. Right, we want to work with them to make sure that they have those skills. But as far as engagement within the group sessions, you can't disappear into the crowd. And if somebody comes in, they have their camera off, they're not engaging, we actually are tracking it live. So the facilitator can actually see like how many minutes everybody's talking, whether their cameras are on, and it'll actually flag like, oh, Andrea, hasn't said anything in a while. So we can, call on them and be like, hey, we'd love if you could turn your camera on, and engage with, like, what do you think about this? If we're not able to sort of get engagement with that, we actually have care coaches who are sort of floating in the background of these Zoom rooms. So we'll pull folks out of group, right? So we can't, if they're not engaging with group, and it happens, right? People have bad days or, stomach aches or whatever, bad day at school, whatever it was. We'll pull them out and we'll address it right then and there. Because you can try to hide in a group of 6 people, but if you're one-on-one, with somebody, that's challenging to disengage from, especially when they're there to help. And what we want to do is we want to address like, okay, is it really just sort of a bad day sort of a thing? What level of engagement are you comfortable with? Is it showing your forehead? Can you show us your room? Make sure that you're safe and we can get you back into group to participate in some way. But also, it's really important insight for us to see maybe that individual isn't okay, right? Maybe they're not engaging group and they're not okay. And maybe we need to, escalate this, get their primary therapist involved, get their support system that's physically there with them involved. And, God forbid, enact their safety plan if we have to. But it's when you look at, if someone's doing family therapy, they're in programming for like 11 hours a week. And in the peripheral to all of that, you have those care coaches who are really, kind of moving the ball along and making sure that people are engaging with the program. We do understand that, like life happens, right? So that, if you need to miss a session or whatever it is, we'll work with people to the best of our ability to, reschedule that and make it up. But we hope that, our design keeps people engaged.
Yeah.
Absolutely.
I had a question about you mentioned the family, family support groups is open to everyone. And this is probably crazy, but is it open to, like, if parents, I know a lot of times the parents or caregivers or somebody, they're concerned about their child and they're trying to get them engaged. Is that something that they could engage with find support or advice around how to get their child engaged in something like Charlie Health?
Absolutely. And so I need to clarify something around that. So they're free and available to like anybody who's connected to a patient who's admitted at Charlie Health. So it's not, unfortunately, we can't offer, we do have some like CE and things that we do offer like for the entire community, and we're looking to do more of that. But, so if say, a family member, had a kiddo who was going through Charlie Health, and they didn't, the kid was referred by a school counselor or whatever it was, the parent hasn't really been engaged, in their mental health journey or kind of providing support. This would be like a great way to kind of dip their toe into the water and like a really non-threatening way to kind of learn, more about not just what our program is and what their kiddo is going through, but how to be, as a parent, supportive and to understand, sort of how to provide the best resources for their kid, and how to process it internally, because a lot of parents will deny that something's wrong with their kid because they may see it as personal failure, even though nothing is wrong, because everybody struggles with mental health and it's just a part of being human. But we want to make sure that we're sort of engaging the family at whatever level they're ready to engage at. So, for people who are resistant to participating in family therapy, we find that, those support groups are a great kind of first step.
Thank you. That's awesome.
Absolutely.
That holistic approach makes all the difference, right?
For sure.
Having struggles in the family, giving those parents just support makes a big difference.
Yeah. And, and we find a lot of kids are being raised by grandkids too, that we're working with. And, there are folks coming from a generation who are sort of talking about mental health, the culture around that is completely different than even it was, for millennial Gen X. And, like it's really, it can be tough to broach that subject with people, especially when you're dealing with, specialty populations like neurodivergent individuals, LGBTQIA plus identifying individuals. And so we really want to kind of break that barrier down because if we're not able to, sort of help create a healthy family dynamic, we can do all the individual work that we want, with the client, but we're not setting them up for the best possible success at discharge unless, everybody's on the same team. So we want to the extent that it's possible and people are willing to participate, to do that.
Maya, did you have a question? No. My other question for you then was, unless anybody has anything else, I'll just ask my question. What does it look different? So if you have a client who comes in who's autistic, what is there any difference, or what kind of services or supports is there offered to autistic individuals differently?
So what we're doing, IOP is sort of just the broad-based model. So like an autistic individual's journey through our program, right? Like, when we receive that referral and we're doing that intake assessment, they're meeting with like, a master's level, clinician who's going to be assessing, looking at their age, looking at, sort of what other co-occurring conditions they may have. So whether they're also dealing with, depression or self-harm or substance use or whatever it is. They're going to be looking at, all right, so what are the most, clinically effective modalities for those, right? Triaging sort of what the conditions are, whether it's going to be CBT skills or, a DBT, attachment-based family therapy, motivational, sort of what's the best modality for this condition, right? And then looking at their lived experience, how are we going to build a group that they're going to most engage with? And so for an autistic individual, what they're going to do is they're going to have, groups that are going through a curriculum that's, a modality that's appropriate, for dealing with individuals with autism. And they're going to be in a group with other, autistic individuals who, to the extent possible, are dealing with the same co-occurring conditions they are. They'll also be matched with an individual therapist who has experience dealing with neurodivergent and autistic individuals. So who's, competent at, working with that population and understanding, sort of what, clinical things need to happen to provide the best support from that end. So it's essentially just customizing that level of care to the needs of that autistic individual. Oh, I think you cut out there for a second. I'm not
Oh,
sure.
sorry. I just thought
Oh,
that's
no, I can-
amazing. I
oh,
love it. I think it's great. Makes a
well,
big difference.
yeah, and we're really, I mean, I think we've treated 30,000 clients so far since 2019, and we're in 37 states, and there's a lot of folks out there doing what I'm doing, and having these conversations. And just as much as we're here talking, we spend a lot of time on the communities listening and identifying, sort of where there are needs for specialty programs, right? And so the genesis of our neurodivergent curriculum, came from the need for a neurodivergent IOP that we were seeing across the country. Same thing, for our LGBTQIA program. The same thing for our BIPOC program. We have a maternal mental health program because we saw there was no accessible service, for moms who were dealing with perinatal mood and anxiety disorders or postpartum depression. We had stuff for military families, and we continue to offer, as we see needs and are identifying populations that need sort of this specialty care, that extra touch to get the most, sort of the best chance at having the best possible recovery. We're doing what we can to design those programs, and then as we're running them, to refine them and make them as good as possible. We also do Spanish language IOP for that reason, because we saw there was a huge need for Spanish language providers. And we're launched that this year, and we're offering more and more scheduling times for that. We do it for adolescents and adults. So it's yeah, it's just really I being a community oriented person who loves Southern Arizona and comes from the nonprofit world, I love the sort of mission driven attitude behind Charlie Health, and really like the combination of both identifying where the needs are and then creating the products to actually serve those populations. It's awesome.
So I had one question, and my internet went out because of something like some lightning bolt, something. But so I don't know if you answered this already, but in terms of engagement, a lot of autistic individuals struggle sometimes with like being on camera or verbalizing with speech. Would it be something you could accommodate if somebody like wanted to have their camera off, but maybe could type things if they didn't want to talk? Like, there's there that much flexibility for someone that's autistic?
So be like sort of beyond like a minimal amount of engagement to sort of be able to participate in the program. Absolutely. And I did touch on sort of the engagement piece a little bit. And so what we're doing is that we will make accommodations, right, to make folks as comfortable as possible. But we're really designing these groups, to be small, to be with other individuals, who are autistic, who are dealing with, or similar age groups, similar, lived experience, so that it is, to the extent possible, as engaging a group as we can build for this individual. And you can't really disappear, right? And I mean, not to be repetitive for the folks on the group, but if somebody's not engaging, we'll pull them out of group and they'll talk with the care coach who's like, hey, is it a bad hair day, tummy ache, feeling sick, a little anxious, what's going on? Is it something that's, we need to really address right now and we can get you back in group? Do we need to escalate, get, more of your safety plan involved, whatever that is. So it's really a lot of eyes on folks. We're not like trusting them to move themselves through the program. And so if somebody is disengaging, like we see that in real time, and we're, course correcting to, to make sure that we can get them back engaged in the program. If somebody's chronically disengaging and like they're really struggling, with engaging in this modality, like, there are limitations to virtual, right? And we want to make sure that there's a big slice of the autistic community that like really can work, well on this platform. And we want to make sure everybody has access to resources. So we will do everything we can to make it accessible for everyone that gets sent our way. But if we're not able to kind of deliver the impact that individual deserves, we're going to work to help find them another resource, and hand in glove with their family and care team. So
Yeah, thank you.
absolutely.
Anybody else have any other questions?
Well, I'll just You will, I think that my information was on the flyer, but I'm sure Kate can get it to you, and I'm sure I can get all your info from her as well. But please do not hesitate to reach out to me anytime if you have any questions about our program. You're thinking of an individual who might be a good fit, or you just have some questions. You will never bug me, and I'm always happy to assist, especially if it's a more complex sort of a situation. I can handhold those and make sure that we get them into care quickly. So really, happy to be here, happy to be a resource for this community, and whatever I can do to support.
So amazing. Thank you, Jacob. And I can attest to that. Jacob has helped me and to handle some things that was really responsive and wonderful. I will put a link to the Charlie Health site as well as Jacob's information in the follow-up email. We'll include the recording of this too, so you guys want to share it with anybody or just watch it again. If you're not here and you missed it. I'll put the recording up for everybody to be able to see. So all the information. You'll be able to contact Jacob if you want.
Thank you all so much for having me.
Thank you so much for being here. Really appreciate it. Thank you, everyone. And yeah, that email will hit your probably by tomorrow, depending how long the recording takes to render. But thanks so much, everyone. Thank you so much, Jacob. I'm really excited about this program. I'm excited to get the word out. So it's really awesome. Thank you.
Thank you.